So I have a client who I want to say about 7, 8 years ago fell and tore pretty much everything in her knee. No ACL, meniscus tear. I'm pretty sure there was some lateral ligament tears as well. Had surgery, but they did not repair the ACL. She's not an athlete. She's not an incredibly active person. She went through physical therapy, did that whole process, still has lingering pain and everything to this day. So we're talking about 8 years after the fact. Met with her yesterday and put her through my PMA program. We activated muscles surrounding her knee, quadricep, hamstring. Happy 4th of July. And also some adductor abductors as well. We worked on some strengthening those muscles in their shortened position, increasing communication between her brain and muscle. Now, what happened with this is for years, she's had a constantly flexed knee. She can't straighten it out. Now, more than likely, there's some scar tissue in there and buildup in there. But her heel's always elevated, so she's kind of walking on the ball of her foot because the calf muscle is tightening up to help support the knee. So what I've been working on over the past few weeks is getting her body to kind of relax and fall into its normal and natural body positionings and movements. So we ran through our pain assessment. We checked out her joint mobility. We figured out what muscles are not firing, what muscles are firing. And we were, during the motions and everything, there is a little bit of discomfort, a little bit of pain because it's a chronic injury that I don't think ever really healed appropriately. And trying to get into everyday activity and get back into the daily grind has some wear and tear on something that's already been worn down. Possible candidate for a knee replacement moving forward, but we're not there yet. So what did I do? I activated some muscles that were not responding, and then we were able to work on some flexibility and mobility work. And when she was done, got off the table and walked around. Heel was flat. Everything was great. And a lot less pain and discomfort than she had before we started. Those are the things that excite me. Those are the things that get me going. So that is what I'm doing, and that is what I'm happy about. And if you guys want to get started, you can go to my website, www.llioi.com, get yourself a free posture exam. We just do that online, and then we could also do a flexibility, mobility, and pain assessment for you. It could be done 100% virtually, and maybe I can help you too. Thanks for watching.